Hello, my name is Idris. I will be doing postpartum mother's assessment. So what you want to start off with is by identifying that you have the correct patient, identifying yourself, so telling them, hey, my name's Idris, and telling them what you're going to do. So I'm going to be doing head-to-toe assessment on you to make sure that everything is fine with you postpartum. So what we will be using is called Bubble He. What Bubble He stands for is an acronym. It stands for breast, uterus, bladder, bowels, lochia, Homan sign, and episiotomy and perineum. So what I'd like to start off with is their breast. So you would check their size, then you would check their shape. So like if they're flat, rounded, the firmness of it. So if it's hard, soft, the redness, if there's any redness around, could lead to multiple possibilities, latching issues, just paying attention to that. And then you have symmetry. The nipples can be everted, inverted, pointing straight out. One could be everted and vice versa. And if there are problems with breastfeeding, you can always recommend that they can always bottle feed, but you should always recommend that breasts are a better choice, but it's totally up to them. So you just educate your patient on it. Next, we'll be moving on to the uterus. So for the uterus, you would want to make sure, but you'd want to check it by simply putting your finger at their umbilical level where it should be, and their fundus, and feeling it. It shouldn't have a soft and boggy feel to it. It should be hard and firm like a rock. And every day it drops by 1 finger breadth until 10 days after it should drop to 10. If it's off to the left or to the right, it could mean that they did not have they did not use the restroom. So make sure before you do your assessment that they use the restroom. Otherwise your results will be inaccurate. Even if they don't feel like it, make sure you always get them up to go do that. Next would be your bowels. So listen to the bowels and make sure that they went. And if they are having any troubles with that, you could offer them stool softener. Next would be your lochia. So your lochia assessment, you would assess for the amount. So the amounts go by scant, light, moderate, and heavy. The full pad shouldn't be filled up in an hour, or not an hour, in 2 to 3 hours. It shouldn't be filled up, because then we're having possible hemorrhaging or even worse complications. There shouldn't be that much, and you just have to pay attention to that. For the odor, there should be no odor or foul odor, is what they say, because that can lead to possible other problems. And then the colors go by rubra, serosa, and alba. They cannot go vice versa. It always has to start at rubra, which is the bright red, and then you have your serosa, which is the pink, and then your alba, which is the whitish. And then next, you would want to look at your episiotomy and perineum to see if there's any tears, any lacerations, to make sure that everything is fine down there. And to check that, we have an acronym, which is RETA, which is a redness. If there's any redness in the area, edema, it's any fluid built up in there, ecchymosis. You have your discharge, see if there's any discharge there, and document it if there is. And then you have your approximation. And then next we have our H, which is your Homan sign. Your Homan sign checks for DVTs. So what you do for DVTs is you will bend their foot, kind of bend their leg, and then push their foot up, and there should be no pain or anything. Check both sides, or check just one side, push it up, and everything should be okay for that. The DVTs, can be seen with warmness to the touch, redness, and there's other things you can look at as well for that. That is a serious complication if there is one. It could possibly lead to PE, which is a pulmonary embolism, which is deadly to you. The last E is for your emotional status, to make sure that she is okay and that she understands what is happening. If she needs any help, feel free to ask. And you should be watching out for her bonding patterns. Make sure that she is okay with her baby, everything's going all right. You're there to take care of them and to make sure that her and her baby are safe and okay. Some complications with that are postpartum blues, which happen with the mother, and some mothers do experience this. There is a high percentage of them that do experience this. It usually doesn't last too long for this. Then you have your postpartum depression, which lasts a little bit longer than this, which is like 1 to 3 months, I believe. And then you have your postpartum psychosis, which occurs within a month, and that is an emergency, a mental emergency. The phases are the taking in phase, which is basically just accepting yourself, and then taking hold phase, which is basically about the mother and the baby, so she's kind of focused on both of them. And the letting in phase is basically letting other people into the life and allowing the baby to be a part of her life. They do have nursing interventions as well to help for this. Before you leave the hospital, they do have you fill out this sheet to make sure your mental state is okay and to make sure you're all set to go home. Otherwise, they'll have to intervene. Yeah.